Hey everyone, this is Rosalina.
And this is Shauna, and we're your hosts for Too Young for This Shit podcast.
This podcast is not just about boobs, but our journey with cancer. We are young millennials, open about giving you our raw and unfiltered look into our lives. We are in no way medical professionals, nor are we offering medical advice. Any medical references are cited directly from public websites or from our personal diagnosis. Some topics and stories may be triggering to those who are fighting, have fought, or have loved someone with cancer.
Hi, guys.
Hey.
We're back.
Yes, I feel like it's been long since, we've done our fertility and, freezing our eggs and embryos. So before we dive into the episode, we're recording this month of October, which all of you may know that it's Breast Cancer Awareness Month. And this is our first time, going through this as survivors. So I would like to know from your opinion or your experience, Shauna, what is it like for you? Have you been exposed to a lot of things online or out on the streets about breast cancer awareness?
I felt very awkward. I was like, this month is a little triggering for me. This is my life. Dealing with breast cancer is my life. And now that we have 1 month that's dedicated to it, I felt like people were waiting to see if I was going to post anything. I felt like I had to almost perform. I don't know, show awareness or whatever it was. And I was kind of like, I don't want to do that. I do my feel it on the first post every month. And I've had multiple women come up to me and be like, thank you for posting that. I started doing my breast exams. I felt something. I went and got a mammogram. I'm negative, thank God. But I would not have gone had I not seen your posts every month. This month I needed to perform even more. I don't want to do that, but I don't know. I just kind of feel like the microscope was a little bit more zoomed in on me. Full of friends that have gone to libraries and have gone to sporting events, and it's I walk for so and so, and then they're writing my name, which is so sweet, but it's just we didn't sign up for this. We did not. It wasn't a club we wanted to be a part of, and this month is just especially almost borderline annoying.
I definitely agree with you that the first day of October, it was a little awkward and weird for me as well. And I thought this month I would see so much marketing and when I walk on the streets, there's just be so many breast awareness walks. I live in LA and I haven't seen any breast cancer awareness walks. If I seen those in person, I think it would be very triggering for me. I'd rather not see that.
Yeah. I did a walk a couple of weeks ago. It was a local breast cancer group, and it was literally around our shopping mall, or outside. It was twice around the first shopping mall, twice around the second one outdoor. But I don't own pink. I don't own anything that's pink. I had nothing to even rep. I had I have a pair of high top Vans that somebody had gifted me. They're the breast cancer.
Oh, wow.
Yeah, it was a special edition. They did a breast cancer collection, and they're sick. They're actually
pretty cool. Okay,
I love them. So I wore that and a white long sleeve shirt and joggers, and I was just this is it. Anybody would not even know. People, people there that didn't know me would not even have known that I wasn't wearing a Team Shauna shirt, and having all these people in Team Shauna shirts,
I've seen those.
Yeah, and that's not for me. Whoever that is for, that's amazing. Some people really like that support. Family members like to show that they got you, and I get it, but that's just not for me. So I did a walk and it was nice. It was outside. You went at your own pace. It wasn't pink everything. I do have to say, it didn't feel like that. It didn't trigger me. And I only did it because I have a friend whose mom and sister had passed from it, and she does it every year. So I was all right, I'll do it with you guys.
Yeah, that's nice.
I didn't do it because I have breast cancer and I want it tomorrow. I did it more because my friend Nicole does it every year, and I just
Yep. And I would have done the same thing. I wouldn't have gone for myself. I would have gone for other people. It just feels like not a lot of attention is on you, even though obviously you're a survivor as well. But it's just a weird feeling, I think, now that we're on the other side.
Yeah. What about the marketing stuff? Like, have you seen
No,
pink
I
on
haven't,
every
which is a good thing for me at least. Actually, there was one thing that I did see. I was in Starbucks with my coworkers, and that was my first time interacting with something that was mentioning breast cancer awareness. So, like, Starbucks had those like advertisements on their bulletin board, and they kind of talked about breast cancer awareness. I actually like don't remember exactly what it mentioned, but I remember seeing it and it hit me differently. I kind of was like a little bit emotional. Yeah, that was a bit weird for me.
I went to Ulta this weekend, bought a scalp treatment, like a scalp cleanser, which I have to tell you
Yes,
about because I
yes,
think
please
you
tell
would
me. Yep.
like it. But for and I go to pay, and of course, the lady goes, "Do you want to donate to breast cancer research?" And I just laughed out loud, like in her face. I was like, "Ha, no, I'm good. I feel like have enough. Like, honestly, breast cancer has costed me enough at this point too.
Oh
Like
shit.
between doctor's appointments and all that stuff. I like
Damn.
laughed out loud. I didn't say, and you know what I'm saying? Like, I
Yeah,
didn't
yeah,
say that I have breast cancer. I didn't want to, like, but I just laughed out loud. Like, I couldn't even control it. It just happened to come out. I was
yeah.
like, no, I'm good. Thanks. Like, 'cause you don't know
No,
where that
you
money is
don't.
going. And like, I don't know. Yeah. Even in New York, the Empire State Building was like pink for the beginning of
Okay. Yeah,
October.
so maybe in New York it's like more out there than maybe LA. Like I don't know, I just haven't seen anything.
Yeah. It's triggering for me.
Right.
That
Let's
damn
go
ribbon.
back to that ribbon. There's actually a nonprofit organization called the Breasties. And so this month they were talking about pink washing and what are these companies doing, when they market about breast cancer awareness, but are they actually like giving back? Are they actually giving a percentage to a foundation that's doing research?
They kind of also stated, like, are you advertising this on products with carcinogenics and things like toxins that can cause cancer? Which I never thought. Their
Right.
campaign, pink
Yes.
washing,
Absolutely.
for anybody who wants to go check it out, it is so informative. Really, like, kind of sheds a different light. A bunch of survivors that are in this campaign, and they're like, "This is our life. Like, this is not a marketing scheme. Like,
Breast
this
cancer
is our
awareness
life."
is not just 31 days, it's like the entire
Yeah.
year. I purchased their t-shirt about pink washing and pink is not the problem. 40% of the proceeds go to stage 4 breast cancer
Yeah.
research. So I thought that was so great. Even though we should continue doing research for stage 1 to stage 3 breast cancer, but I really, really think that we need to do more research on stage 4.
Well, it's the most underfunded.
Yes,
It's
right.
yeah, it's so underfunded. And I think everyone just sees the name brand, like, Susan G. Komen, like, that's where people think to donate. There's so many
Organizations.
other, yeah, like, do your research. Keep Abreast is a great foundation. They do a lot of research for stage 4. Breasties does a lot of educating too, and they do a lot for especially young women like ourselves. Like, the Breasties for me was the most amazing Instagram account. It was like one of the first ones I found. So
Same.
informative,
Mhm.
kind of gave you a little bit of hope too, because you see these young women who fought cancer, beat cancer, living their lives. Like, it kind of gave you a little bit of hope. Like, okay, like, they were dealing with the same thing we were doing, and look at them now. They're happy, they're
Mhm.
healthy, they're having babies, they're living their lives, they're getting engaged, they're dating. It was like such a great
Absolutely.
thing to see. There's and since we're doing this episode as a fertility episode, I follow, she's another one that I like love. Damn Good Yoga is her account. Started a foundation, and she is raising money for surrogacy for breast cancer patients. Surrogacy is so expensive. She's starting a foundation to help with fertility and surrogacy. And I just think that's so incredible. In the show notes, we'll just put a couple of the organizations we can, vouch for, and just, like, that would be a great place to donate your money to. It does not always have to be the Susan G.
Yeah,
Komen.
especially if the organization is a nonprofit, they need to claim everything that they do and where the money is going through and all of that. So you can actually look up their annual reports and see like how much is going through cancer research or how much are they like funding it to their employees for their salaries and all of that.
Right. Even donating to an organization that provides like resources for breast cancer patients. The Breasties does like a retreat, and the money that they raise pays for young women to go on these like retreats, or even like mental health resources. Young Survivor Coalition does, Zoom meetings and meetups and things like that. Like I think, the research portion, obviously, like we need money to fund research, but even donating to organizations that like truly give great resources to cancer patients, like breast cancer patients, like I think that that's like a good
That's a
place to
really
put your
good
money too.
point. And last thing that I wanted to mention is I think the Breasties is partnering up with this other nonprofit organization where, when you undergo like cancer, there's a lot of women who get pregnant, have a child, and they can't breastfeed. And so getting breast milk is not covered under insurance or like baby formula.
And it's insane. Your insurance will pay for a breast pump, but won't pay for formula or breast milk for your child. The whole thing is kind of all backwards. I felt the same way with the cold capping. Like, oh, okay, my insurance will cover a wig, but they won't pay for the cap to save my actual hair. Too, like, it doesn't even have to be money too. Like it could be volunteering your time, volunteering, if you're a mom that's a super supplier of breast milk, donating that to a bank. Donating your time is just as good as donating money. Volunteering, putting on those walks or, just anything that like lending a hand, to a breast cancer patient, bringing a meal one day or, it doesn't have to be just all money. It really could be anything and it's helpful.
I definitely agree with not everything has to be about money, but just putting your time where it's needed. Shauna mentioned, like, if you know someone that's going through treatment or, is a survivor, but not doing so well, just being there for her.
Bringing over a meal or offering to take their children for the day if they, have kids so that they can rest. Even too, like I found during treatment, like I got super tired while driving, like, offering just to drive somebody to a doctor's appointment. Like
Having
it could
dinner
be
with
anything.
them, like taking them outside, walk with them. Yeah. Last thing I did want to touch upon, like you were mentioning how you had friends or family that like would go on walks and put your name on the sticker of like saying like I walk for Shauna. This morning, my cousin actually mentioned me on his story, and him and his girlfriend was going through the breast cancer walk, and I thought that was, I don't know, that hit me in a way where like shit, like he's walking, for me. And he like mentioned that I was his superhero. That's like the best thing someone could do, really. And so I'm really appreciative of that.
It's so nice. Friends last weekend that went to they were in Kansas City for a Kansas City football game and they held up a sign, whatever. It was like, for Shauna O'Brien. And Matt showed me the picture. They texted it to him and I was like crying. I was like, that's so nice. It's nice. It's nice
Just
to have the
supporting
support.
others is the best thing that you can do. I will say that I believe my other cousins know that I have breast cancer and maybe they don't want to ask me questions or maybe say anything or maybe they are just not that emotional. I don't know. But I really wish that my other cousins, especially like the men, would come and maybe like send me a text. I saw them recently in Vegas and they didn't mention anything about like, hey, Rosalina, I heard about what's going on with you. Like nothing like that. And I really wish that they
Yeah.
did say something, you know?
I'm an open book. Clearly, you're an open book. We're doing a podcast. You know what I'm saying? But there's some people that are like absolutely don't want to talk about it. Even like Matt's friends are constantly checking in with Matt and being like, "How's Shauna?" Like they don't want to text, not that they don't want to text me, but I think it's just there's I think a level of because it's a female issue that it's I think they just feel like they don't want to bring it up, they don't want to upset. It's a lot. It's a heavy thing to be going through too. So it's just I think they don't want to trigger too. And meanwhile, I'll tell them like anything.
Yeah, I've become more open about my experience. Like in the beginning, I wasn't at all. I wasn't open. And so I think as time passed, I'm more open to talk about it because I think it's really important for someone to be aware. A lot of people don't know the extensive process that a patient goes through. And like my brothers were asking me the other day about like radiation, what that process is, and cuz I was telling him like, "Oh, like I haven't seen any like skin changes, but over time, the end of their treatment, I could get sunburn and a tan and there's all these things that could happen to your skin." And he didn't know that. He was like, "What do you mean that you get a tan or like you can get like a sunburn?" And so I had to explain to him like all that process.
I'm yeah. I needed to talk, I think, about it too, because like it was happening, and I don't know. I just like I felt better to say some certain things out loud than it was to, try to like in my own head wrap my head around it almost. I don't know. I think it too, and for the awareness part, like I will be as vocal as I
Now,
can.
talking about today's episode, fertility, it's just like I mentioned in the beginning, like it seems so long ago that happened, even though it's only a few months ago.
Yeah, but I feel like there's such a buildup to this episode because, we've mentioned like, oh, we had to do that, but we're saving that for our fertility
Yes. And
episode.
here we are. Now we could talk about it. I kind of wanted to start off with the question of once your oncologist told you that you should see a fertility specialist before you go through the treatment, or for you, Shauna, like before you went through surgery, what was going through your mind?
I knew early on that I was going to freeze my eggs. Like I knew that that was just they gave me the option, but I had already had made my mind up that I was going to do it. It wasn't like I need to sit and think about this. And I kind of also didn't have the choice to think about it because well, I had like, I had already made my mind, but like I didn't have the time to sit and weigh out pros and cons and weigh out like different fertility clinic. My cycle was coming. My surgery was for the next month. And like this was the time I had to do it. My doc gave me a referral to somebody who took my insurance. Like they found me my
Nice. You
fertility
had no
specialist.
hesitation about preserving your eggs, or like the thought about being a mother in the future. That was always in the cards for you.
As a young kid, like I always knew I wanted to be a mom. I nanny for a living. I'm like constantly taking care of somebody's children. But I remember in like my late 20s being like the baby fever is real. I want to say I turned 30 and then I started to think like maybe I don't want kids. The world is crazy. And I think it's especially harder for kids now in the age of social media. It's just not
I think it's
easy.
harder for parents now. Yeah.
Oh, definitely, definitely. So I think over the last couple of years, I've been probably, 3 years, I've been kind of going back and forth with do I want kids? Do I not want kids? I can fully handle a child. Like it's not even about taking care of them. Like some people get, like think of having an infant and that's like the scariest thing. Like, no, at work, I love working with infants. I actually feel beyond calm working with an infant. So like I know I'm fully capable of doing it. The thought of raising kids in this world right now scares me more than actually having a child. I was doing it more as an insurance policy. Even if I don't want them, at least I have eggs on ice. I do it more for the insurance. And, I don't want to look back in, 5 to 8 years and really want a child. And I didn't take the steps before cancer to like get me there. Like I feel like I would be so disappointed in myself. It seemed like a no brainer to just be like, even if I don't use
When
them, at
my
least I have them. Yeah. And
oncologist
what
told
about you?
me that I should see a fertility specialist, so this was before starting chemo treatment, my mind was just checking things off of a list of like, okay, my oncologist told me I need to do this, so I need to do that, just continue with the checklist. My thought process is like, of course, I'm going to preserve my eggs. I guess it was just a thing that you need to do before you start treatment. But diving deeper into my mindset and what I was thinking, I do agree that I didn't want to also make the mistake of if I didn't preserve my eggs now, would I change my mind later in the future and say, like, shit, I should have done that because now I want kids. Throughout my years, I've been wishy washy of whether I want to have kids or not. Like what you mentioned, Shauna, everything that goes on with having a kid nowadays, of just the social media and behavioral issues, and yes,
And
they're
they're
way
expensive.
more expensive now than what they were before. And so the thought of having a child should be thought out so intensely in a way where like, okay, if I have this child, how would my life would look like? How can you take care of the child? Can you take care of the child financially, like emotionally? There's just all these different components that you need to think about. And
Right.
so that's why I think I've been wishy-washy of personally asking myself, can I do this? Am I capable of being a mother? And the other side of me is thinking about I kind of see myself as a mother, but I think maybe because in society you go through the different stages of
Right.
yeah,
Right. Like
especially
that's the
after
next
marriage,
thing to do.
that's the next thing to do. But I want to challenge that. Not everyone wants to have a child. Not everyone is capable of, taking care of a child. So, anyways, I know that was like a wraparound of the question, but
I think, I don't know, I have a dog. I love my dog. I don't need a baby right now. I was kind of like, I don't know, I'm like kind of content. Like I could go
the
either way
next
at this point
thing
too.
is cost. At first, I didn't know whether my insurance was going to cover fertility. And I kind of like went through this loop around. I have Aetna insurance, but then the fertility is actually through another insurance attached to Aetna called Progeny. So then I had to call them up, set up an account. Thankfully, they actually covered 95% of the cost. I'm super happy that my insurance covered that because that's another thing to ask yourself is, okay, can I afford this right now with these other treatments that I have to do? Being a breast cancer patient is not cheap at all.
Super expensive. I wish my insurance covered it. It didn't because I had to do 2 rounds. I spent basically about $15,000 out of my own pocket
Didn't
to
you have
fund
your
my
friend
fertility
made
treatment.
like a GoFundMe?
My friends
Yeah.
made a GoFundMe, which was so great. Yeah. So, I mean, that helped. The first one I paid completely
Okay.
out of my own pocket because I was even before my GoFundMe. Yeah. And then it's $1,000 a year to keep
Yes.
your stuff on ice. So, I mean, it stays
More of the
expensive,
story, children are expensive.
Yeah.
Yeah, before you even
Before you
have them.
have them. We're talking
Yeah.
money and we don't even have them yet. I know, it's crazy. Luckily, my insurance did cover my fertility meds because that would have
Mhm.
cost me thousands of dollars, even more. So I was like grateful that the insurance company covered the fertility meds. There is grants though, like Livestrong has a grant. There's this awesome foundation called the Chick Mission that give grants to cancer patients. They're a really great organization. And I just didn't have time. My cycle was starting, and you start your fertility treatments like when you get your period. And I didn't even have the time to apply, wait a week. I didn't have the option to do it. So it was kind of like I had to pay out of my own pocket
Yeah,
and I had
because
to
you
do
already
it
had
quick,
your
you know?
surgery date. Yeah.
I had a surgery date. Yeah. And no, originally with my plan, it was I was going to start chemo 3 to 4 weeks after my double mastectomy. So in my head, this was like my
For
one
those of you
shot
out
to get this
there
done.
like wondering reasons why you need to preserve your eggs or embryos before you undergo all these treatments is because if you are going through chemotherapy, they could create damage to your eggs. And so damaging those eggs could affect your fertility and affect you in getting pregnant and having a child. So that's why it's important to do the IVF process before you start treatment, going through the next steps. So, Shauna, your clinic found a fertility specialist for you. For me, my medical oncologist recommended me someone at UCLA, but because Progeny is a network for a few clinics. UCLA wasn't one of them. So I actually had to go out and find one. I think it was a bit tricky because with these clinics, I really wanted to find a clinic that had really good reviews, that had good doctors, like nothing super sketchy or trying to get more money out of you. So I really was trying to find the best clinic that served me well. I found this clinic called California Fertility Partners, and it's close to my house where I can actually walk to, which was important to me because I don't have a car. I called them up, told them that I'm a new patient. They were pretty booked up. I was recovering from surgery and my chemo treatment was supposed to be scheduled in May. So I think this was in April. Yes, so April. They were booked out that their next appointment was sometime mid-May. And I'm like, okay, well, that's not going to work. I also mentioned to them that I have breast cancer and like I'm going through chemo treatment soon. So I needed to preserve my eggs quickly. I would definitely say that's a time where I pulled out my cancer card because I was like, listen, I'm on a time crunch here. So then we hung up and then I was defeated because I was like, oh, damn it. Like this place was super close to my house. I had to find like another clinic. I also chose that clinic because they had female doctors, which I wanted a female doctor. I did not want a male doctor. The next day, they called me back and they said, Dr. Chung has an opening and she would like to see you. So can you come in tomorrow at whatever time? I'm like, great. Like, this is fantastic. Thank you so much. And so because I pulled the cancer card, they were able to fit me in. I'm super glad that that happened. When you go through the IVF process, you have options. You have the option to freeze your eggs only. You can create embryos. If you have a partner that's a male that's able to donate his sperm, you can combine your eggs and sperm together to create embryos, or you could do half and half, which I did. So I froze half my eggs and half of my embryos. And that you can only do if you have enough eggs to preserve. Obviously, you need to ask your doctor, depending on when you do like the ultrasound, how many eggs you have on each side. So they do an ultrasound of your left ovaries and then your right ovaries.
So I ended up going to see a fertility specialist that was recommended because they took my insurance. So I went and hated the guy. I hated him. My nanny, my boss at the time, was going through IVF, like just had her egg transfer. My mom had done IVF to have me. So I know what it is. I didn't know like the names of the medicines, but like I know the process of it, you know? And he asked me, and what do you know about this process? And I like maybe got 3 words out. I was like, "Oh, I know a little bit." And he goes, "No, you know nothing." And I was like, "Yeah." It was like so rude. And then like he was talking and I'm sitting there and like white knuckling like the seat because I was so mad. I was like,
Yeah.
I almost walk out, you know? So he gets like a phone call or something and he has to leave the room. And I look at Matt and I go, I fucking hate this guy. I hate him. And then I don't know if he must have heard me or like I maybe he like realized like what he had done, how rude it was. Almost like mansplaining to me. I was at that point like,
You were like
"Ooh,
taken
I gotta find
aback.
this
That
guy."
response is not a response that you expect.
Didn't even give me the option to answer. He came back in and I think realized that he was like a little aggressive and like came back in like a totally different doctor. So I was like, all right, I got to get the show on the road. Lee was like, you need to get a blood test and I guess to check my hormone levels. I think that was what that was for. See how many ovaries I had, something along those lines. So I did it. And then he works like closely with a fertility specialist, worked at like a clinic in New York City. They are combining teams, but they're in 2 different offices right now. So we ended up having to go to the clinic, Matt and I, after my blood test came back. And like that was when we were trying to figure out when I could start the shots and figuring everything out. We went and Matt had to give like a sperm sample like immediately. Matt's story is so funny. I walk into this room and there was like erotic pictures on the wall. And I guess whoever was in there before had like some crazy Pornhub on the screen. The lady like and had to bring him into the room, was like trying to give him the gist, and like there's porn on the TV playing, and she was like, "All right, here's your thing, just like put your sample in there and like leave it."
No
Like she just like
way.
couldn't
Oh
get out
my
of the room
God.
fast enough because there was like porn just blasting. And Matt is like he like walks in and there's a couch and there's like like
Yes.
the puppy pads. There's puppy pads like on this leather couch, and like there's porn like blasting in the background from the person that was in there before, and there's like these erotic pictures on the wall. He was dying
Oh
laughing. He
my
was like, "This
God.
is the funniest thing I've ever like." He came out, and I filling out like tons of paperwork, and he comes out with this like shit eating grin on his face. He's like, "You have no idea." It was really funny, but they gave both of us blood tests, and I do have to say there was, at least for myself, a couple of really good pros of having to do fertility. I have a very low egg count. I would never have known that had I not gotten breast cancer and not ended up at this clinic, you know? So they told me, you know, going through the process, a normal woman my age or your age can get anywhere from like 15 to 30 eggs in one. So when, you know, when you said like, did you freeze half or whatever? And
Yep.
it kind of all
Yep.
depends on what you know, how many eggs you get. My first egg retrieval, we got 2 eggs. My egg count was that low. You know, I would not have known. And then even if I had not done, let's say I didn't want to do the fertility in like 5 years after I'm done with tamoxifen, we wanted to try, it would have been so much harder. I would never even have known. That was like one of the pluses of having to go through this experience. And there's not many, but that ends up being one. And another thing is too, is I'm getting a blood test. My partner got a blood test and they test you to see genetically like what you're a carrier. It was nice to kind of know like Matt and I are not carriers of the same things, that it's going to create health issues in our future children. You know, not everyone does that before they go and have a baby. Like a lot of people don't go and do this genetic test to see, like, you never know. And it's kind of nice, you know, after being told you have cancer or breast cancer, like it's nice not to have any surprises. So for me, I loved that aspect of the fertility, you know, just like knowing like nothing between the two of
That's the
us is
part
going to
that
mix
I
something bad in
enjoyed
the kid.
about the fertility process too, is just knowing how many eggs you are able to preserve. And I think that was something I actually never knew about. There's so many women out there, especially now, which is unfortunate, that they can't get pregnant naturally. So a lot of people go through the IVF process. Kind of backtracking, the first step, your doctor would take blood tests, what you mentioned, Shauna, but then also doing vaginal ultrasound. It's not painful. Yes,
It's just
it's a little pressure. If
pressure.
any
Yeah.
of you out there had the copper IUD put in, like it's not that painful. Trust me, it's like less painful. So they go in and look on your left side, count how many eggs you have, and then go towards your right side and count how many eggs. And then basically, she would mention to you whether you're able to fertilize half and half, like half eggs and half embryos, or whether you can just do one. That was really great to know. After you see your doctor and all that, you have to go back once your menstrual cycle starts. The day that you're bleeding heavily is when you have to go, because that's the start of your medication.
My situation was a little different because I had my fertility specialist that was in the office. So you have to go for monitoring. So like every couple of days you're going to get a vaginal. They were trying to make sure that your ovaries, everything's all those medicines are like working, you know? So I had to go back and forth between the fertility specialist at the doctor's office and my other fertility specialist at the fertility clinic. So, you know, they were working closely together just in like
Right,
separate
right.
offices. Yeah, when I have 2 different doctors because I loved the fertility doctor at
That's great. Yeah.
I loved him. You know, you said you wanted a female doctor. It's so funny because I've only had female gynecologists. You know, I was kind of the same way. Like I only want a woman.
Yeah.
And it's so funny because I think after going through so many doctor's appointments throughout everything, you know, like half of New York had seen my chest. I didn't even think about it until afterwards that, oh, wow, that was like I have a male gynecologist now. I don't know. It didn't phase me until after. I was so comfortable with him that it made
Yes,
it
absolutely.
easy.
Before we dive deep into the medication, I wanted to first talk about what made us want to preserve embryos. When my doctor mentioned I could do half and half, my mindset was just, oh, I'm just going to preserve eggs. I'm not going to create embryos. But then when I was talking to my boyfriend, Brian, every doctor's appointment I had, I would just tell him everything that I'm going through. And I basically mentioned embryos, but I never said, hey, what do you think? Do you want to create embryos? Like, he basically told me, I'll create embryos with you. Like, I didn't even have to ask. And I was like, wait, what? Are you sure? We have to sit down and have a serious conversation about this.
I also think too, you guys
Yep.
live together, you have a dog together, same Matt and I
No,
live
not
together, have a
married.
dog
Yeah.
together, but we're not married. Making that decision together, you know, we had to have so many conversations. I mean, I was going like kind of actually insane of being like, well, what happens if we break up? You know, like what happens? This is my
I
only
asked
shot. Like,
those
how are we going
questions
to handle
too.
this situation?
Yeah.
what if, you say, okay, yeah, I can have the embryo. Like, do you want to be a part of the baby's life? Like, that's half your kid too. Like, I went down this insane, like, insanity of like, just like, what if this situation, that situation. Matt was kind of like, well, we'll cross that bridge when we get there, if we get there. Like, I was like, but I have to think about this because, like, regardless, like, if we don't, like, this is, and I really want a kid, like, this could be it for me. You know, this could be my only shot. And if we're not together, like, we need to figure out making sure we were
Yes.
making the
I
right choice.
really feel that even if you've been with your partner for X amount of years, you still need to ask those questions because it's very serious. It's a process that you
Yeah.
can't go back. Can't be like, oh, never mind. I don't want to do this anymore. Like once you've done it, that's it. You guys have something
Yeah.
together.
Right. I joke around like we have kids on ice.
Yeah,
You're
that's
just
so
on ice.
funny. Yeah. What my doctor did ask me was if you do want to do half and half, you need to decide whether you want more eggs to freeze or whether you want more embryos to freeze. I told her that there's an odd number. I want you to freeze more eggs and knew that that was the best choice for me because what you just mentioned, Shauna, like if something happens where Brian and I break up, I still have 13 eggs that I can rely on if I want to have a child.
Exactly. Yeah. And had I had more eggs, we would have done, probably the same thing. When I went into my first like egg retrieval, like we didn't know, they said maybe 8, and I was kind of like, okay, not the typical amount of eggs that like a normal person has. So like, let's just see, he said, he's like, we'll see what we get, we'll go from there. But when I woke up, they were like, we had 2. And that was like super disappointing. It kind of was like a blow because I just got diagnosed with cancer. Like now I'm paying all this money, like 2 fucking eggs, like I was pissed. I was like, well, do we make embryo? At that point we had decided to do embryos too, because once it's already created, it's like a better chance of you getting pregnant. And he was kind of like, I would just freeze these, to be honest with you. Like, immediately was like, okay, well, trying to map in my head, I'll have surgery in less than 2 weeks. So maybe I can squeeze in one more round. I'll talk to my oncologist or chemo. Like maybe I can squeeze in one more round. I ended up freezing my first 2 set
If
little eggs.
you were thinking about what's the difference between freezing eggs and then freezing the embryos, well, with eggs, even though they mature, you still don't know whether they're good or bad. Some people may decide to create an embryo because then you can actually do a genetic testing and do a biopsy and see if the embryo, if it's abnormal, that means that it produced more chromosomes, more than 23. And so that basically say your kid may have Down syndrome or you may have a miscarriage.
And also too, with the eggs, not every one of your eggs is going to fertilize. Like, my aunt did IVF and she said I had 20 something eggs and we got 3 embryos out of the 20 eggs. Luckily, I got 4 eggs for my second and 3 became embryos. Is great,
Yeah,
because I didn't
and
have
I
a lot
think
to
that's
begin with.
another thing I wanted to mention. There are tons of women out there that, do this IVF process more than once. And so even though with you, Sean, I was unfortunate that you had to do it twice, but you had the choice at least to do it again. And the second time was better because you were able to do embryos. And so you have like a better chance.
I mean, it's nice having the option. We have it. I have 2 eggs and when that time comes, like, I'll figure it out, but at least there's both. So that's good.
Yes,
Let's talk about
right.
the
That's
meds.
a whole process there.
So, I had mentioned like I didn't even have time to get like a grant or anything like that, like, because my cycle started. I had the most nightmare experience of trying to get my medicine because the fertility meds come by mail order. And I had said, like, waiting for approval from the insurance company and then trying to get the meds and then also doing it on this timeline. I was freaking out. My meds didn't come in time. Thank God, like, my doctor had samples of everything so I could start for 2 days before and then the meds finally came in the mail. But it was like I was like running to specialty pharmacy in Brooklyn trying to get one medication. It was a nightmare just trying to get all my meds the first round. The second round, I knew I was doing it in advance and got everything sent. I was like ready to go the second time, the second round. So like I had everything prepared, but the first time, nightmare, it caused so much stress. And those fertility meds too, out of pocket, are so expensive. So I was like so grateful that my insurance company, even though they didn't cover the cost of the procedure, egg
Yeah,
retrieval, they
that's
did cover
awesome.
the cost of my meds. Yeah. So I ended up having to take letrozole, a pill. I had to take Gonal was one of that was the injection pen. And then Ganirelix is the shot that you take day or two
I
before
had
your
Gonal,
retrieval.
Menopur, Letrozole, Cetroside, and then the Lupron kit.
Yeah, I had Menopur and the Gonal, and then the Ganirelix I had to take, like I said, day before, and then just the letrozole pills. That was it for me. But yeah, so it was just 2 shots
When you
in the
inject these
evening I did
shots,
it.
it needs to be at the same time every day for, 11 days or so. So you have to be wise in choosing the time that you can remember. Setting an alarm would be great just as a reminder. The nurse essentially shows you exactly where you need to inject it. So basically, she would say day 1 you inject it on the left side, day 2 you inject it on the right side. And so where you inject it, she says, put your 2 fingers out and then touch where your belly button is. With the 2 fingers, go to the left and then down 1. And so that's where you inject it and squeezing your gut. And then that's when you start to inject it. I don't know if your medication came with the pre-settings where you didn't need to measure how many milliliters that you need to inject,
Yeah, the Gonal was
like
like I
turn
had to
the
do
dial. Yeah,
yeah,
yeah.
but I
Yes.
loved that. Yeah, I loved that. Menopur
Yes.
was annoying
Yes.
because I had to mix
Menopur,
it
you have to
myself
mix it.
with the powder. Yeah, and I don't know, the Gonal was not as pain like Menopur burned for me. Like I remember being like I hated doing that. And also too, I gave the shots myself. Like I didn't want Matt to do it. Like I felt like I needed to be in control of the shot. Like I needed to expect it and like it was just like I didn't
When
struggle
I
giving myself
got the
the shots at all.
medication, and again, my medication was mailed to order. So with Progeny, they don't mail out all of your medication. They only approve a certain quantity amount. So every day or like every 2 days, I had to call them up and say, can you mail the rest out because I need this. I would say before 5:30 because I would take my shots at 6 p.m. The first time I got the equipment, it's nerve-wracking. I don't know if it was for you, but it was definitely nerve wracking. Like, I didn't want to make the mistake with the Ghana. Like, you just have to turn the dial, which was super easy. But the Menopur was, I think, the most difficult part because you actually need to mix it yourself. And when you inject it with the syringe, there can't be any bubbles in the syringe.
My doctor sent me videos on how to do it, literally like a tutorial video, making sure I mixed it correctly, and it helped so
They didn't
much.
send
It
me a
made the process
video,
so easy.
but I was smart enough that when I was at the clinic and the nurse was showing me exactly how to do things, I was like, I need to record this on my phone. So I recorded it on my phone. And I would say that was the best thing that I could do because I could look back at the video and see exactly what she did so I could mimic that. If they didn't send you the videos like they sent to Shauna, record it. Highly recommend to record that.
It made it so easy. I felt so bloated though, the first round that I did. I was so bloated. I wasn't emotional. I didn't feel crazy mood swings that they said I could experience. I just felt like I PMS, but I never experienced like the bloat or like the cramps anytime I got my period. So like it was like a different feeling for me. And I just like couldn't wait for
Yeah,
it to
I
be done.
think for me, yes, I did feel some bloating. Once you're in it every day and giving yourself a shots, like I feel like I felt more bloated each time. I did felt some mood swings. I did feel that it was nerve-wracking to give myself the shots. I didn't want Brian to do it. I was like, hell no. If I told him that he needed to do it, he mentioned that he would ask the nurses to do it for me. If for whatever reason you can't get the shots to work, you can actually call up a number and then a nurse will actually come by your house and do it for you. But luckily, I never had to do that. But I always wondered if I was injecting the shots correctly. When I went back to see the doctor, because what she does is like during that time period that you're giving yourself the medication, you need to see the doctor on a regular basis.
Every 2 or 3 days, you go, they take blood and you get a vaginal sonogram. They are checking your ovaries to make sure, everything's
Yes.
going
So
according to
like
plan.
what she does is the sonogram slash ultrasound, she count how many you have on the left side, how many you have at the right side, and measure them. By measuring them, she can tell which ones are
Working. They're checking blood work every 2 days to make sure everything's going. Your levels are
getting to
all
this
how
stage
they're
where
supposed to
they're
be.
ready to be retrieved. And so they needed to be at the right amount of size. I forget like what exactly the size needs to be. Um, but basically that would tell you if the injections are working. Yeah.
It's 2 days, I think, before your retrieval. They make you take a shot.
You
I
mean
took
Lupron?
Ganrelix. Is that the same one you did? Oh, maybe that's what I don't know. I
Yeah, to like
What's just the
shut
one you
down your
before?
ovaries. Yes.
Yeah, and that's basically your last injection until
Yep.
you end up going for your egg retrieval. But fertility doctor that worked at the clinic,
Wow,
he
that's
gave me
so
like his
nice.
cell phone number, and he was the nicest guy. I was like in love with him. He was just so amazing. He made the process so, even when I was disappointed, he still made it easy. Like he was just a really great guy. Shout out to Dr. Thornton. I loved him. He called throughout the whole time checking on me, and he told me to take that shot, and he goes, and then tomorrow I need you to take a pregnancy test. And I was like, what? Like, he's like, yeah, he's like, that's how we know that like the last injection you end up taking. So basically I had to pee on a stick, and if it came up positive, that means like I
I
was
mean,
ready
I
to go
didn't
for
pee
my
on
egg
a
retrieval.
stick, so I don't think they made me do that.
They made me do that, and it was hilarious because I sent the positive pregnancy test to like all my friends, and they were like, "Oh my god!" And I was like, my one friend Katie was like, "I literally just started crying. I was so happy for you." And I was like, "Nope." But yeah, no. So that meant I was ready for the
The whole
retrieval. So
process of giving yourself the medication and all that kind of took about 11 to 12 days, so it's actually not that long.
no, and it goes quick. It really does. It goes quick, and then you know, going in for the egg retrieval, that was my first time ever on anesthesia. Like I've never been put under for anything. So I was like a little nervous. I originally was on the NuvaRing. I was on the NuvaRing for I think 15 years. Loved it. Never had an issue. I wanted an IUD, a copper IUD. I was like, okay, like, you know, I have heard in the past how bad it hurts. And I was like, I don't really kind of want to experience that. Like, maybe I can just have the fertility doctor, like, while he's in there, just throw it up there
Oh,
for me,
yes, yes. I see where this is coming.
I bought the IUD from my gynecologist and brought it to the clinic to have my fertility doctor there insert it while I was passed out. So I like hand the guy my box with my ID. I'm like, all right, we're ready to go. And I was in like a good headspace. I was like nervous because I'd never been put under, but I was like, let's get it done at this point. So it was quick, 20, 30 minutes. And I woke up and I was like ready to walk out. Like, like they bring you into like a recovery room. Like there was a woman next to me that was like moaning and like she was having a hard time waking up. And I was like, literally, I wanted like snacks and I wanted to get the fuck out of there. But they had come in and they had said, they had only gotten 2 eggs, which they thought they were going to get 8. So it was a disappointment. But he said, after surgery, call me and we'll get you in before you start chemo. We'll do another round. And I was like, all right. He's like, I didn't put the IUD in because I know, this isn't the results that we want. And we'll do another round. We'll give you even more. Like, now that we know what your body produced on those hormones, the next time we'll really load you up and you have a better chance of getting more eggs. I was like, okay, great. But when I woke up too, like my fertility doctor like looked at me and he looked scared. So it kind of like scared me. He was like, I've never in my life have seen anyone move under anesthesia like you move under anesthesia. He's like, we had to hold you down. Just nothing went right, basically, for me. How
So
was
what
your
Shauna
retrieval?
mentioned, it's like 20 to 30 minutes. It's not like a long surgery. And also, since I did this after my mastectomy, pairing the two surgeries together, this egg retrieval is not as intense as a mastectomy. Yeah, it's
It was nothing. I wasn't in pain after. It wasn't like it was nothing
yeah.
like I thought it was gonna be. It was easier. And even to like waking up from the and like anesthesia, I literally was like ready to go. Like I didn't there was like I didn't need a recovery. I just needed
Yes,
like snacks and I
exactly.
needed to go.
Kind of just going through, what they do when they give you the anesthesia and then you're out. They basically take an ultrasound guided needle and insert it in your ovaries, and that's how they actually retrieve all the eggs. When I woke up, you're not in a room by yourself. There's curtains in between. And so everyone that is in recovery like kind of goes through those sections. There aren't any walls like in between you. And so you hear other people or like what doctors are talking to like the patients about. So I found that to be a little weird because what if a woman who's ready to be a mother and she hears like another doctor mentioning to the patient, like, we were able to take 40 eggs out of your like ovaries, which that was a number that I had. And that doesn't mean that all those eggs were matured. It just means that's how many they were able to retrieve. But for me, I felt awkward and weird because these women who are right next to me, then like a curtain away, hearing this, I would feel some type of way if I was there, I'm doing the IVF process, I'm ready to be a mother, and then I hear that my egg count is lower than this other person's egg count. So I thought that was a little weird. But, anyways, yeah. So I basically had 40 eggs that were retrieved, but out of those 40, 26 were matured. And out of those 26, like I mentioned, I did half eggs and half embryos. 13 were frozen. I didn't expect to have that many. I am fortunate to get that many, but yeah, I had 13 eggs frozen. With the embryos, basically, when I got my egg count, they basically kind of sent it over through the portal and said, 13 eggs were frozen and then 12 embryos are in culture. So, like, they need to develop cells. And so that process took about 7 days. 3 days after fertilization, that's when they can see whether the embryo would contain about, 6 to 10 cells, and then seeing whether it would get to like the blastocyst stage. And so once it gets to that, then we were able to identify how many of those embryos went into that stage. I had 9 embryos, but then when they did the biopsy just to see whether the embryos would be chromosomal like normal or abnormal, we actually found that they were, I think, 2 that were abnormal. And then there were like a few that were discarded as well. So at the end, I was able to freeze 6 embryos.
Okay, that's great. And then still have all those eggs. That's
even
awesome.
even before you start the egg retrieval process, they give you this big document that you need to sign. They do a document just for freezing your eggs, and then they also do a document for freezing your embryos. So basically, like your partner needs to be there signing it. This is why like you need to have a serious conversation with your partner, because basically you guys need to decide these things. So one of them being, if for whatever reason one of you die, do you want to discard your embryos? Do you want to donate your embryos? Do you want to give it to someone else? Like, you guys need to like decide at that moment. And also the other question is like, if one of you decide not to be together anymore, that's another question of like, are you going to donate them? Are you going to discard them? Or what? Like, so those are the serious conversations that you need to have. And if you guys don't agree, that's a problem.
Yeah. So we ended up actually, we did that, but we also did like an agreement that we got written up by a lawyer just to like both cover our bases. Like I said, we're not married. And it was just kind of like a little bit more like concrete, you know, for us and what we wanted.
Yeah.
So,
Yeah.
but it was a lot like trying to figure out, even too, like, in the thing, the one we did with the lawyer, it was also too, like, you know, in the event that we're not together, I choose to have this baby, like, giving Matt rights to the baby if he wants the baby, or not, like like we had to kind of go down this like really crazy road of what ifs. And it's like, and especially when you are like trying to process your diagnosis of breast cancer and then you have this on top of it, it's just like a lot. And it's like it's the stack of paperwork. You're right. It was obscene. Obscene. And I had to do it twice because I
Yes.
had to do a second
Right.
round of
Yeah. Oh my God. That's so annoying.
my second round of IVF. I ended up with, like I said, four embryos. I mean, I ended up with four eggs and then got three embryos out of that. And right. So I went in. I was actually more like pumped for the IUD because I was like, we're going to get this done. They couldn't get it in. I went for the
Yeah.
IUD.
Right. 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 Yeah.
Yeah, I didn't get to
Yeah.
finish my story from before. They couldn't get it in. They were like, they couldn't, yeah, they said like they couldn't get it in. Like basically, in order for me to get an IUD, I was going to have to go to Planned Parenthood, get dilated before doing this. And I was like, no, we're not doing that. I'm not going to Planned Parenthood to get dilated to have me be awake for this insertion of the IUD. Absolutely not. So we canceled it. Like canceled. I was so upset. I was like, that was like kind of like more. I was more pumped to get that done than like
Yeah,
to see
I
how many eggs I was
I
gonna
feel
have
the
because
same way
I had
actually too.
yeah.
That was the best time to insert the IUD. So you don't have to freaking feel like all the pain that every woman go through when
Yeah,
that gets inserted. So
yeah,
actually like what happened then? Like you weren't able to.
absolutely. They just like couldn't get it in. Basically, I couldn't get it up there because like I needed to be a little dilated for it to like fit up there.
I
I
mean,
guess
did you
I don't
end
know.
up
Like just
like
on top of
having the IUD inserted like another time? No, no. Yeah.
no,
Okay.
nope,
Yeah.
no. I'm on no
Mhm.
birth control at the moment. It's fine. I mean, I get basically with the hormone
Yeah.
therapy and I'll be on tamoxifen.
Yeah.
It's gonna be like next to impossible, and my leg count like
Your ovaries
to get
like
pregnant
shut
with
off,
this. So
so you're basically on menopause. So
yeah, and then
yeah.
then mixed out with the low
I
egg
think I
count,
think
and
you're
I
right.
think
Yeah.
it's gonna.
Um, man.
I don't know. At
Yeah,
this point,
that's true,
anything could
yeah.
happen. So who knows? It's
Kind of
sure.
going back through the recovery process of your surgery, I basically, like, recovered fine. Definitely feel some cramping, and that was the worst part of the recovery period. Like, I was in so much pain that I couldn't really, like, walk that much or whatnot, and so I think it took about, like, a few days for it to, like, settle.
Oh, I felt fine. Like I came home, I put the heating pad
Yeah.
in between like my legs, like my stomach a little bit.
Mhm.
I napped and then woke up and we ate and I was fine. I actually
Oh,
felt fine both
that's
times
great.
after.
Yeah, that's great. Yeah.
Yeah. Yeah, I mean, who had 40 eggs too. Like, imagine trying to have a go in and retrieve all those eggs.
Yes.
So, yeah, that's
That's
it.
a good point. Yeah.
Yeah,
Because I had way more retrieved. Like that's probably why I felt so much cramping. Yeah, yeah. That makes sense.
yeah.
Yeah.
Actually,
Going through this
yeah.
whole entire process, have our viewpoint of fertility changed, especially like, being forced to think about fertility because of our diagnosis? Curious your thoughts.
I mean, I'm glad I did it for the insurance policy. Like, even if we don't end up using them, I don't think it was like a waste of money. It was for the peace of mind of having that to fall back on, 100%. I think having breast cancer has changed my outlook on wanting to be a mom. I kind of, went over earlier like all the fears of, you know, bringing kids into this world today, you know. Um but also, you know, I just I don't want to bring a kid into this world and then not be there for them, you know. Um Matt and I have had to talk about like my cancer feeds off of my estrogen and progesterone. Putting my body through this is can risk a reoccurrence for me. We have highly talked about like there's a very very good chance that we will do surrogacy because I'm not going to bring a kid into this world and then put my body through that. Like take myself off all the off all the hormone suppressants, pump my body full of hormones, have a baby. It's just like I to have a baby that I'm not going to be there for. God forbid I end up stage 4. God forbid I don't have a long lifespan. Like I would never want to do that. My aunt died from metastatic breast cancer. Her kids were older. My youngest cousin, I think was 19 at the time, and it was just as devastating. I don't know if I want to risk that. The only way that I would do it is if we did a surrogacy, I think at this point, because I don't know. I'm scared. I don't want to do that to a child. And then even too, like passing that down. Now, my daughter, in her young age, if I ever have a daughter, I don't know. I don't know what the genders of my embryos, but it scares me. It scares me to do, have to have like my young daughter have to think about that, and get screened early and all this stuff. Like, I don't know. So that, it has my brain thinking differently. Like, about and like I said, it's not about like I nanny, I'm very comfortable with children. I can fully handle raising a child, but now the health aspects, my health, like being able to be there for, watch my kids grow up, like those factors kicked in, after being diagnosed and after going through chemo and, seeing the support groups and seeing, it's a lot. I don't know. I don't know if we'll do it. I don't know if we can do it, but I'm kind of at this point, like, I know for sure my doctor had told me to wait 5 years before, be on the hormone suppressants for 5 years before even trying to have a kid. So I'm at this point where it's like, you know what, we have 5 years, we'll travel, hopefully get another dog, like, like we'll live our lives. And then when that time comes, we will revisit. And I'm kind of like in a good place mentally with that, are like very gun ho about still being a mom and, you know, because, and also too, did a single, you have always, you expressed to me that you wanted to breastfeed, like, just how has this changed
Yeah,
since
I
after?
I agree with you about having a surrogate. Like I have thought about that too because unfortunately, being pregnant is a risk for us now, even more than ever. Unfortunately. And so I have thought about that, but then I always thought it was just so beautiful seeing women pregnant and seeing them glow. And it's just, I always saw myself that way. Like if I ever get pregnant, like I want to go through that period of feeling the baby inside me, going through the process, because I feel like it's such a beautiful thing for women to go through. But also, like, I really need to think about my health as well. So, having a surrogate is something that I have thought about. I have thought about if I were to have kids, I don't want to regret doing like a double mastectomy and not be able to breastfeed.
And that's valid too. A lot of pediatricians really push it, for the nutritional value of it, for the immunity aspect of it. They're pretty gun ho, and there's a shame in not breastfeeding your kid, and you know, I think you and I have had that discussion. Like, part of me likes to not have the option. I've seen my friends struggle doing it, and for me, it's just like not an option. It's not even something I have to think about. It's not something I have to even struggle with at this point. And I'm kind of like, in a weird way, just kind of like happy that that is off the table for me. And it's funny because as far as like, you saying like, the bonding aspect, and that is so important, especially with newborns, like, NICU babies, the skin to skin contact and all that stuff. It's funny because I nanny. I have a relationship with every single one of my nanny kids. Um, Claire is I was with them since the day they came home from the hospital, and the bond I have with her, and she's not even my child. Like I, I love that kid so much. Like, she is my own. Like, I would take a bullet for her, and she's not my child. And that's the thing too. I think that I know the relationships that I have with these kids. The
This
bond is going
was
to
our
be there.
story, and I hope you gotten something out of it, even if you had a laugh or two with Shauna's story about her IUD. Oh my god, that was hilarious. Obviously, it was very disappointing for you, but just like talking about it now.
But I literally handing my own IUD in the box to the doctor, being like, "Please insert this, sir." I know, wild. But also, too, we will, post in the show notes the foundations that we spoke about in the beginning, like how you can support breast cancer funding, or just various nonprofits or organizations that like we can vouch for. But do your own research, and anybody who has questions or anything can email, for fertility stuff, or if you're in New York City, the clinic I went to is amazing. If you're in LA, Rosalina's got a clinic for you. Just we're here.
Thank you all for listening to our podcast. Sharing our stories with you has been incredibly healing for both of us, and we hope it helps other women in their journeys through breast cancer.
Ladies, if you enjoy this episode, please share it with your friends. Help us reach more women by subscribing and rating us on Apple Podcasts and Spotify. You can also follow us on Instagram at TYFTS Podcast, and our email is tyftspodcast@gmail.com. We will link any resources from the episode in our show notes.